are other things that we have to have on every scale. So we're gonna come into the room. So hi, Mr. Jones. I'm cleaning my hands. My name is Deidre. I'm here to put an NG tube down. I heard you're real uncomfortable and we need to decompress your stomach and get some of this stuff off of your stomach. So we put this tube down into your nose and it's gonna go down into your stomach, and hopefully we're gonna connect it to suction and get you feeling a little better. So before I start though, I have to measure and make sure I'm gonna go to the right place when I drop the tube down. So I start with the tip of the tube, and I'm actually going to measure from the tip of your nose to the back of your ear, and I kind of loop it around your ear a little bit. And then I'm gonna guide it down to the xiphoid process, which is that right at the tip of the breastbone and the ribs where they end. Okay, so I got that marking right here now. I have a little black marker already on there, but for safety, you could do another black marker or another type of marker, or we could just do a little piece of tape. Sorry. Considering these are mannequins, it may be harder to get down than you think, but we'll just do that for now. That's my marker. At the top of that tape is where I'm gonna go down to. And then before I actually get started, I'm gonna get some tape ready to tape it up onto your nose. So it's actually gonna tape over the bridge of your nose when it's all said and done. So I tear a piece of tape and I kind of pigtail it in half. That's why we use this particular tape, because it rips real easy. And then I'm just gonna prepare it right there, ready to go for me. I'm gonna get a little closer to you. Okay, otherwise, let me make sure everything I have is set up and ready to go. Let me put it over there. Okay, so as I was mentioning to you, this tube goes down into your stomach and it helps to relieve your discomforts. And so as I navigate this, I'm gonna push it into your nares or your nose. And before I get started, I'm gonna close one side and have you breathe. Okay, I'm gonna close this side and have you breathe. Do they both feel equal? And the patient says yes or no. So we're gonna go down the one that's a little easier for you to breathe through. And then also, I typically like to stand on the opposite side of the nair I'm going into. The bridge of the nose kind of comes at an angle, so the septum of the nose does, so it's easier to thread it in kind of at that angle. So with that, as I start entering into your nose, it is going to get to the back of your throat and it's going to probably make you gag, and it's also going to tickle a little bit. But what I need you to do is you're going to take this cup of water and you're going to just sip on it and try to keep swallowing the tube down as I'm advancing it. Now I'm going to keep going and going and going, and you're not going to probably be able to talk much during the procedure. So what I want you to do, if anything is too painful or hurts, just raise your hand so to indicate to me, raise his hand, to indicate to me that I need to stop, okay? Also, if I see you having trouble breathing or anything like that, I'll also stop, give you a break, make sure everything's going okay, and then we may keep going or pull it out depending on what we find. So before I get started, I'm going to put a little bit of air into my syringe and connect it to the end. I want that to be ready to go before I start. I'm also gonna go ahead and, let's say I opened my package, I'm also going to put my lubricant right here. And then I'm also gonna get my stethoscope sort of ready for me behind my ears, so that once I get it down, I can check that third thing, which is the air bolus. Alrighty, well I think I'm ready to get started. So they'd be holding this cup in their hand and sipping as I go. And I'm gonna say that they said the left nair, their right nair was the best route. Alrighty, here we go. I'm gonna dip it. Okay, and as I go, you start swallowing. Swallow, swallow, swallow. You're doing good. Swallow, swallow. Let me check and make sure it's not coiled in the back. Okay, swallow, swallow, swallow. Keep swallowing. We're almost to our marker. And let's say we got there, because these mannequins are hard, okay? We got to our marking. I'm never going to let it go, because if you sneeze or anything, I will lose the tube placement. So I'm gonna just put that tape right there on the bridge. And I know this is in your face, I apologize. And we're gonna put one little pigtail wrapped around the tube all the way down. Okay, I kind of got it stabilized. My other little pigtail, I always tape it to itself so it's easy to take off if I need to. And then I'm gonna wrap it around the other one. So I know that's in your face, but that's how it's got to set, okay? All right, so now that I think I've got it placed, I'm gonna put my stethoscope in. I'm gonna put my stethoscope right onto the abdomen where that right below that xiphoid process. And I'm going to instill this bolus of air. And I hear a positive air bolus, so that's my first indicator we're in the right place. I'm now going to disconnect, I'm actually gonna pull back a little bit of stomach acid, and okay, I got a little bit. So I'm gonna take this off and put my connection on. Okay, I got it stabilized. I will pin it up though if I get an accurate pH here. I'm gonna instill a little bit of this. Okay, yep, let's see. Okay, yep, between 3 and 4, so that's a good indicator. We're also in the right place. That's our second check. I'm gonna call down, beep, beep. X-ray, can you come get Mr. Jones X-ray to make sure I got this NG tube in place? Sure, okay, they'll be right down. So now while we're waiting on them, let's just make sure that this isn't hanging your way. I'm sorry, put my gloves, okay. So I get a little piece of tape. These are all just my own little tactics. I don't know if this is what the paper says or any of that. Okay, and I have it stabilized here, otherwise this would be pulling out of their nose, okay? Give it a little bit of slack. I tape it around the tube to itself, then I put the safety pin through the tape into the gown. All right, so it's in place, it's looking good. The x-ray is gonna come, make sure we're definitely where we need to be. After that, I have some medications ordered, and I'll come give those to you through that tube. Thank you, and then you're done.